Osteopathic physicians, also known as DOs, are among the best trained physicians in American medicine today. In fact, DOs have the same practice rights as MDs in all states and the District of Columbia. And they practice in all the specialties that MDs do. In osteopathic medical school, DO students cover all the same subjects as MD students, but integrated into the osteopathic medical students' curriculum are osteopathic philosophy and osteopathic manipulative medicine. In addition to medicine and surgery, DOs use their hands to diagnose and treat patients for mechanical problems and other medical problems.
As osteopathic physicians, we believe that many diseases are related to problems in the muscles, bones, nerves, lymphatic system, circulatory system, and internal organs. As an osteopathic physician, we focus on finding where there's problems or dysfunctions by using our hands.
What are the benefits to choosing osteopathic physicians?
Using osteopathic manipulative medicine can reduce the reliance on medication and surgery, and quite often you can see results in as few as 1 to 3 visits.
For me, it's the pursuit of seeing something more in my patients and being something more for my patients. By seeking to know my patient as more than a medical condition or a constellation of symptoms, but rather as a unique individual with a past, values, and desires, I'm better equipped to partner in their medical care and hopefully meet and even exceed their medical expectations. My DO training taught me how to use my hands to arrive at a correct diagnosis and to provide relieving treatments. I strive daily to effectively care for my patients using my medical knowledge, my trained hands, and connect at the level of the heart. For me, that's the DO difference.
OMM stands for Osteopathic Manipulative Medicine. This is the manual therapy that all DOs receive training in, at the heart of which lies the interconnectedness of the musculoskeletal system with every other system in the body. OMM allows DOs to apply the principles of osteopathy to better evaluate the body, its tissue quality and movement, and then adjust it as needed to support the body in its capacity to heal and maintain health.
Using osteopathic manipulative medicine, DOs focus on treating the underlying problems. Many times this can be done in conjunction with medications and/or surgery, or in place of medication and surgery, depending upon the underlying condition. This can help with such problems as headaches, neck pain, back pain, joint pains, pneumonia, and gastrointestinal disturbances.
Now, the benefits in clinical practice are truly many, from empathy and compassion to actually getting rid of pain. It's amazing when I see patients in the clinical setting, when I see them for back pain or shoulder pain or neck pain, then they've seen many other clinicians and they've never been touched. Well, that's not what we do. We, as osteopathic physicians, touch our patients. We care about them. And the comments that I get from, wow, you are the first doctor that ever touched me, or just the fact that they know that I can find the areas where they have pain and validate that, yes, I feel that muscle spasm. Yes, I feel this bone out of position. It validates that they are truly in pain, and they truly appreciate that. And that develops trust. So the power of OMM in clinical practice is real and it's powerful. There's actually also global benefits of OMM in the clinical practice. For example, working in the emergency department, I have had patients come in with chest pain. And young 30-year-old male with no cardiac risk factors, they don't need to go through an entire MI workup. I have been able to fix anterior tender points on the rib cage where the pain completely resolves in all ages of patients. And while of course I do a comprehensive evaluation, I have been able to save the patient time, stress, and a lot of anxiety, and save the healthcare system thousands and thousands of dollars of not having to admit a patient just because they said those two words, chest pain, where I knew as an osteopathic physician that this chest pain was purely musculoskeletal, and I had the ability to correct it right there in that emergency department and send that patient home happy and pain-free.
My practice is a little bit of a unique one because I do exclusively osteopathic manipulation. But the benefit to my patients with that is it gives me a different lens to treat them that they haven't been treated with before. So for example, we treat a lot of pregnant women in my practice, a lot of sacroiliac joint pain associated with that. In shadowing some women's health physicians, if they have pain in pregnancy, they just kind of say, it's part of pregnancy, it'll get better, sorry, just deal with it. And that's not necessarily the case. There's a lot that you can do with osteopathic manipulation to help improve functioning, to help improve mobility, to help decrease pain. And even though it is a temporary situation, for anyone who's ever been pregnant, this can be a life-altering event. So if you can improve that, then you can just help the patients immensely. Additional ways that it's helped my practice is it gives me another route to go down in giving them options for conservative treatment. So for example, someone comes in with shoulder pain that turns out to be a partial tear of a rotator cuff tendon. Well, yes, they can do physical therapy, they can do ice heat, they can kind of let the inflammation resolve on its own. But in addition to that, we can do osteopathic manipulation, which gives them another route to receive help. It gives them another way to be benefited without anything that's invasive, without anything that's horribly cost effective, and without anything that takes up a whole lot of their time. So for me, osteopathic manipulation has been immensely helpful for my patients.
Well, it does certainly help provide us a better understanding of underlying principles around osteopathic manipulative medicine, and also in regards to the effectiveness in terms of how does osteopathic manipulative medicine work in terms of a variety of different problems that we see in clinical medicine. In terms of osteopathic medicine historically, the number of resources that we've had in the past have really been a bit meager. So there's certainly an increasing emphasis on trying to improve the research infrastructure and the research environment that's available within the profession and specifically at the colleges of osteopathic medicine. So in that regard, here at RVU, we're trying to make available increased levels of funding for, say, intramural funding for research activities, and also trying to bring specific faculty in to improve the research culture here at the university.
I found that the best way for them to do that is to just attend outside courses, whether it be courses for cranial manipulation, for still technique, for HVLA. There's any number of courses that are provided and available that usually are 2 to 4 days. So depending on your availability, depending on how busy your clinic is, you can clear up some space and attend some lectures. One of the best resources, and this is a longer commitment of time, is the annual AAO, the American Academy of Osteopathy Convocation. It's held in some very nice locations every year, but that's probably the best time to go and not just receive additional lectures for OMT, but to collaborate with people who are deeply invested in the profession.
OMM has benefited me by allowing surgery not to happen on a couple body parts, has allowed freedom of movement on my neck. The big one for me is vertigo. I had vertigo very bad. I've had it for 2 years, and then when I went down to the clinic, they did an intraoral procedure. It was 3 different sessions, and I couldn't even get my teeth cleaned at a dentist because I couldn't even lean back that far in a dentist chair. And so just being kind of normal again and being able to get my teeth cleaned and being able to lay down flat on a surface and not have dizzy spells with vertigo. That's been awesome. One time specifically, I remember I was going down and twisted and threw out my back. I couldn't walk. I went to the clinic, and between a fellow and Dr. Bodrero, I don't know what they did to me, but the next day I could walk again. So not only have they cured me and allowed me to keep my lifestyle going, the fellows and our OMM doctors or OPP doctors, on top of that, it's just made me more knowledgeable about how this process works, how to get inflammation down, how to stretch, how to make sure that injuries don't reoccur. They've been working on my hand thumb for about 2 years now, and this keeping me from having surgery, reconstructive surgery in this whole area. So it's just things that they've done for me that I'm so grateful. Every time I call them miracle workers, and I love them so much, and I'm so grateful to be at RVU and have this opportunity to participate in this great OMM experience.